Good afternoon, everybody. My name is Dr. Anita Gadhia-Smith. Thank you to the Art of Living organization for asking me to be here today. It's really a great pleasure to be with you and to have the opportunity to talk with you a little bit. And I must say, I didn't know what to expect, and this is truly one of the most outstanding groups of women I have ever seen. So beautiful, inside and outside. So I'm honored to be among you. Just to tell you a little bit about myself, I am a psychologist in Washington, D.C. I'm also an author. I wrote a book called From Addiction to Recovery, A Therapist's Personal Journey. And I'm in private practice in the Washington area. I work with individuals and couples and adolescents and adults. And I work with all kinds of addictions: drug, alcohol, sexual addictions, eating disorders, gambling, and I work with family members of people who have addictions as well, because family members also need a lot of help. And particular to this conference about women, what I've been thinking about is just how much more freedom we have as women today, even compared to 20 years ago. We have more power, we have more money, we have more potential, we have more equality, and with all of that comes greater freedom, but also personal responsibility. And when we have greater personal responsibility, we also have greater challenges. So many more and more women are also being affected by alcoholism and addiction, as well as their family members too. There's an ongoing negotiation between managing freedom and responsibility. It's a little bit like we all need structure in our lives, but we all need freedom. And there's always this careful line that we walk between the two. And finding balance in our lives is really the key, I think, to right living. Along with the increase of alcoholism and more freedom and responsibility is also the stigma around the disease. And I'm here today to speak to you about this, to try to help to reduce the stigma. Recently, over the past year, I spoke in Sweden and in 3 different cities in India about alcoholism and addiction. And I remember there was one of the cities that I spoke in India was Mumbai, and they have about 16 million people, and there was only one woman in recovery that I came across in the recovery groups, which, out of a city of 16 million is quite a small number. So there's a lot of stigma all over the world. I'd say there's probably a little bit less in the U.S. because the recovery movement was born there, but the recovery movement is spreading out all over the world, but there's still a lot of stigma to overcome. And so that's one of the reasons that I wrote this. This is my book is a self-help book about how to create a life in sobriety and recovery. And I do talk about the addiction to drug and alcohol, which started when I was 12 years old and lasted for 15 years. I'm now just about to turn 48, and I've been sober 20 years now. I wrote the book a couple of years ago. But I really wanted to write something that would contribute something in the world that I hadn't seen much of before. A lot of therapists write books, but very few write about themselves. They usually write about their patients or theory or other pieces like that. But I really wanted to talk about the truth about what it's like to go through alcohol and drug addiction through very difficult years and very difficult family situations, but more importantly, to come out of it and to learn to choose responsibility and create a life of meaning and purpose. And so 2/3 of the book is devoted to creating a life, not the downward spiral that's so much at the core of addiction. And to me, that's the most important part. How do we come out of whatever it is? Because everybody is facing something at some point in their lives to overcome. And what matters so much is that we come out and move forward and use what we've been through to help other people. The treatment community is up against a lot with this disease. The biggest barrier really is denial. And denial is something that most alcoholics have. They feel like they don't really have a problem. When their family members talk to them about it, they tell them they're crazy and, you know, you're the problem, it's not my drinking, all of this kind of stuff. And so then the family members can go into denial too, and they start not knowing what's real and questioning what's what. And so it has an impact on the whole family. And there's even some denial in the medical system. In the medical community, you will not necessarily, if you take your loved one to a doctor, you will not necessarily get a diagnosis that's accurate, because, you know, combined with the lack of awareness in some parts of the medical community and the denial and resistance and rationalizations of alcoholics, you have a formula for keeping the disease underground. And this is something, my guess is that a lot of people in this room have known someone who's been touched by this disease. Would you raise your hand if you've known someone or had any connection with someone who's been touched by this? Okay. And that's a good number. Now, the good news is that there's treatment. The primary forms of treatment are self-help groups, individual treatment, and treatment in rehab treatment centers, either inpatient or outpatient. And then that brings the person into recovery. And as I came into recovery 20 years ago, that's just the beginning. That requires a lot of ongoing work to maintain and stay in the right direction. It moves at the speed of a glacier, but once you get that ship turned around ever so slowly, the job is to just keep it moving in the right direction. And so what I have done in my life, and the reason why I'm here, is to try to let my life speak for something. And I think that everyone in this room has the opportunity to let your life speak for something. And I want you to leave here today and think about what that is. And, you know, ultimately, we're all just a vapor of a breath in the grand scheme of the universe. But how do you want your light to shine? And that's what I want to leave you with. Thank you.